When we handle suspensions, we have to be aware that there are several problems or instability risk that may happen with a suspension. So, two most common instability problems associated with suspensions are sedimentation and caking, and also microbial contamination. So to ensure a good and stable product, we have to bear in mind that we have to address these issues, okay, before we can be sure that the product will be stable throughout the shelf life. Sedimentation and caking are two instability problems that can occur due to the physical characteristic of the particles or of the internal phase in the preparation. So apart from sedimentation, there's also two other problems that may occur, which are flocculation, coagulation, and also Oswald ripening. Okay. So if you can look at the figure here, flocculation coagulation means that the particles, okay, the bigger particles will sort of attract the smaller particles to attach on their surface. Okay, so when more smaller particles become adsorbed or attached on the bigger particles, the particles will be the appearance of the particles, of the suspended particles, will become bigger and bigger. So this eventually will lead to problems in ensuring the uniformity of the dose that we measure when we want to administer the drug to the patient. So thus it is very important for us to make sure that the particles that are present in suspension are uniformly has a uniform size. Okay, the size are not does not have much difference between each other. If you have different sizes, what I mean is you have small particles and big particles in a suspension, this will lead to the problems of flocculation, coagulation. That's why I will always encourage you to first ensure that your particles are finely distributed or finely sized before you formulate a suspension. The third problem is Oswald ripening. This is also another problem that may happen that that is related to the size of the internal particle size. Okay. Okay. In some formulation, more than one suspending agent may be needed to increase the viscosity and gel-like state of the suspension. So for certain formulation, because of the problems of sedimentation and caking, you have to include more than one suspending agent to increase the viscosity of the preparation. With a higher viscosity preparation, the particles will sediment slower, okay, and this will lead to a much slower formation of cake at the bottom of the bottle. Okay, basically the sedimentation of particles will follow the Stokes law. Okay, I wouldn't ask you any question regarding this equation, but I want you to understand what is the meaning, or what is the relations between the factors that is described in this equation. So you can see here V refers to sedimentation rate. So V, the sedimentation rate, will be directly influenced by the diameter of the particles. Okay, the bigger the particles, the faster is the sedimentation rate. And also it will be influenced by the density of the particles and the density of the medium. So if the density of the medium is high, so the sedimentation rate will be slower. Okay, and this will also be influenced by gravity, but we have stable gravity, so you cannot change that much. Okay, and also this one is the viscosity of the external phase. Okay, if you have a higher viscosity, of course, the sedimentation rate will be slower. Okay. The sedimentation will also be influenced by the type of suspension. We have two types of suspension, which is flocculated and deflocculated suspension. So, if you refer to this figure here, flocculated suspension has a faster sedimentation rate, okay, but the formation of cake will be less likely. But for deflocculated suspension, okay, for deflocculated suspension, the particles will remain suspended much longer, but once it sediment, it may directly form a cake. So for the purpose of stability, if you want to preserve a suspension for a longer time, you might want to choose flocculated suspension as compared to deflocculated suspension. Okay, microbial contamination. Microbial contamination is dangerous to patients. Why? Because patients are sick, okay, they are not well, and their body defense might be in jeopardy. So we have to make sure that the product is safe for the patient. So contamination by microorganism in our product will lead to the development of fall odor and turbidity, besides affecting palatability and the appearance of the suspension. So these are the effect that can be seen physically, okay, but chemically the changes may also happen or may also occur to the chemical structure or to the chemical to the activity or to the effectiveness of the active pharmaceutical ingredients. Okay, so contamination by microorganism is dangerous to health, especially in immunocompromised patients such as cancer patients, HIV/AIDS patients, pediatric and geriatric patients. Okay, because their immune system are compromised, they can't defend themselves. So we have to make sure that we don't add on to their problem. Metabolism of microorganism will produce certain byproducts that will change the pH of the preparation that will eventually affect the chemical and physical stability of the preparation. So we have to make sure that we add in sufficient amount of preservative. Okay, we need to add in preservative for product that need to be kept for a long time. Okay, because this will prevent the growth of microorganism, and eventually we will make sure that the chemical and physical stability of the preparation will be preserved.